they allow the flavors in the much more dangerous product, which is very hard to wrap your head around. But yeah, so Massachusetts was the first to implement a statewide ban.
Hello, world. Welcome to the Vaping Unplugged podcast. Everything you need to know about vaping and tobacco harm reduction.
Hi, everyone. You're listening to the podcast Vaping Unplugged, where we discuss tobacco harm reduction policies globally and generally talk about less risky nicotine alternatives. My name is Liza. I work for the World Vapers Alliance, and today I will be hosting Jacob Grier, who is a freelance writer and author at Portland, Oregon, and who has written about tobacco policies for publications including Slate, Reason, The Atlantic, and Liberal Currents. His books on the topics are The New Prohibition and The Rediscovery of Tobacco. He's also written 2 books on cocktails, Raising the Bar and Cocktails on Tap. His current project is co-founding Seabird, a new link sharing app for online writing. First of all, welcome, Jacob. It's a pleasure to host you here today.
Hey, Lisa, thanks for having me on. I appreciate it.
Absolutely. Very interesting biography that you have, a lot of interests, a lot of different professions, I would say. So before talking about the topic that interests us, before talking about vaping or less risky nicotine alternatives, I just wanted to ask you to maybe talk about yourself. What do you do generally? And also how did you get into writing about tobacco harm reduction and tobacco policies?
Yeah, so I currently live in Portland, Oregon, which for people who don't know it is a West Coast city in the United States, known for being very bohemian and liberal, particularly with drug policies. I moved out here, oddly enough, to work in the bar industry, which is what I've done for quite a bit of time, if not full time, then for much of my efforts in the past 15 years or so, and have written a couple books on that. But prior to that, I was living and working in Arlington, Virginia, and Washington, D.C., working in public policy. I was in the think tank world there. And that's where I got interested in these topics. So in my early 20s, I was working in think tanks, doing some freelance writing, trying to decide what topics I wanted to cover. And around that time, 2 things happened that became relevant to what I've been writing for the past 2 decades. One was that a friend of mine introduced me to cigars, and I realized that I really enjoyed premium cigars. And at the same time, smoking bans became popular in the United States. So New York was one of the first cities to do it. Washington, D.C. was doing it. And so I became really interested in this as a policy issue. And what interested me at the time is that the basic aims of smoking bans were generally positive. There was a lot of smoking in public at that time, and it was really unpleasant. And I don't think anyone really wants to go back, to say the 1980s or the 1990s, when everything smelled like cigarette smoke and you were sitting next to someone on a plane or in a restaurant who was smoking. But at the same time, the means by which these policies were pursued had a lot of problems, namely that they were very dismissive of smokers and their rights, and they were very dismissive of property rights. And there was also a lot of, let's say, mixed quality in the science on the topic of secondhand smoke, where you had some very good, very serious studies trying to figure out what the potential harms were of being around environmental tobacco smoke. And then you also had some really outlandish studies that used very small sample sizes and came up with wildly implausible results that really no one should have been taking seriously, but that were promoted really widely in the press and used to advance these very restrictive policies. So at the time, being interested in this topic, it became something I covered quite a bit, about how the rise of smoking bans was accompanied by some very anti-liberal policies and also some really problematic science. Yeah, which brings us to vaping, I should say, which, I guess it was probably 6 or 7 years later that this became more on my radar as a topic. And I just saw the same thing happening, often with the same people, where there were some legitimate concerns, about not wanting people to smoke or use nicotine, especially young people, but paired with some really alarmist science and obviously very restrictive policies that weren't very respecting of adult vapers themselves and what they wanted to do.
Mhm. Yes, we will be talking about vaping and all of those restricting policies more in detail. But before we do that, since you already mentioned different fields where the prohibition tends to fail, I wanted to ask you this more a generalized type of question, because as I perceive it, the prohibitionism it has the similar pattern when it comes to different substances. Doesn't matter whether it's drug war or it's alcohol bans, they have been failing. It's just my perception, but the question is, what do you think generally about this type of prohibitionism? And are there any similarities between this type of, restrictive approach?
Yeah, every drug is different, but I think there are some commonalities that come out of prohibition policies that we've seen both with alcohol prohibition in the United States and elsewhere, and with the drug war for the past 50 years in the United States. And the most obvious one is that you create black markets. You try to ban a drug, but people still want it. People still want to supply it. There's a lot of profits involved in doing so. And so you create illicit markets, and then that spirals out into much more other restrictive policies and violations of civil liberties, because it's a very hard law to enforce. And so you get violations of privacy, you've got property seizures, you get rises of violent gangs who are competing to sell the products. I feel like we don't need to belabor the point. We've seen the many problems with drug prohibition in the US. The more subtle problem that I think you get is a more dangerous supply. And we've seen this in a lot of different ways, like with alcohol prohibition. The government actually went on requirements that alcohol be denatured because alcohol has other uses. And so they didn't want people to be drinking alcohol intended for industrial use. So it was intentionally made toxic. And that led to a lot of people dying. We've also seen that in other places that have prohibition, where it's hard to ensure the quality of the alcohol, and people end up drinking adulterated products and getting really sick. We see that in Indonesia in the present day. And that's a huge problem with opiates now in the United States. The rise of fentanyl and the inability of anyone who's using opioids to even know what they're getting exactly has created a huge overdose crisis, with I think around 100,000 deaths a year now in the US. And that's because people don't know what they're using. And in some cases, it's often impossible to get the supplies to test it. We've made it hard to go to safe consumption sites. All these things that make it hard to have a safe supply arise from prohibition. And it's a problem we've seen here in Oregon, where I live, where we actually rolled back some drug decriminalization recently. And one of the problems we had is that we decriminalized possession in most cases, but we did nothing to ensure safer supply. And so, of course, overdoses continue to be a problem in that situation.
Thank you. You've been talking about the trade and all the black markets that emerged due to the prohibitionism, and I think it would be relevant to talk about the case in Australia right now. We as WVA always warn policymakers that all those prohibitions actually lead consumers to get those products on illicit black market, where we don't actually know what these products are, and it's way riskier actually. Australia is known for its, let's say, draconian policies on nicotine generally, and vaping is also prescription only. As far as I know, illicit trade has been happening there a lot. And from what I've heard, for instance, if there is one person who is getting a prescription from a doctor that they can use vapes, then if anyone else in the family wants that, they can easily get them, right? So it's a big loophole that, and this policy has been ineffective so far. But instead of lifting it up, I think the government is kind of directed towards getting more and more of it. So you've written a very interesting article on the case study on what recently happened in Australia. So can you tell our listeners about that case, and generally where did the prohibitionism on nicotine lead the country?
Yeah, Australia is a fascinating case because they've always been upheld by people in mainstream tobacco control as one of the best model cases for how to approach tobacco. And like you said, they made vaping prescription only, so they have one of the strictest tobacco regimes or nicotine regimes in the West in that regard. They also have sky-high tobacco taxes. By some measures, the highest tobacco taxes in the world on cigarettes. Something like 65% of the price of a pack of cigarettes in Australia is just taxes. And on top of that, they had graphic warning labels, along with the typical smoking bans that you would see in a lot of other countries. So by the measure of conventional tobacco control, Australia was doing everything right. They were doing exactly what activists said they should do. But the results have surprisingly not been great. One, like you said, the black market for vaping has arisen. And that's now like a very strong thing. I saw the measures. There were almost 2 million vapers in Australia. And by some estimates, 9 out of 10 of them were getting them on a non-prescription route. So that policy obviously was failing in terms of trying to control vaping. And then on top of that, smoking rates have stopped their decline there. Where Australia used to be a leader in fighting smoking, that has kind of bottomed out. And there's even some signs that young people are taking up smoking at higher rates than they used to. So you have this very weird situation in Australia, and it's one of the only countries I think that's ever done this, where you have more smoking and more vaping. and by any measure, that has to count as a policy failure. And on top of this, the illicit markets in Australia are one of the first I've seen in the tobacco world to follow this path that drugs have taken in other countries of being taken over by sometimes violent criminal gangs. And that's driven by two things. One, it's the restrictions on vaping, which means that basically everyone who's interested in getting vaping products is getting them from an illicit source. And then two, the tobacco market is also shifting to that way because the taxes are so high. And the way this is spilled over is really remarkable. I saw some early stories about this and kind of ignored it. And then I kept seeing more and more reports. But basically, there's turf wars among biker gangs who are bringing in illicit tobacco and vape products from overseas and getting them into stores throughout Australia. And they're both fighting each other and basically extorting stores. And so what seems to be happening is they are threatening a lot of retailers to say, look, if you don't carry our product, we're going to burn your store down. And this is unheard of in other countries for the tobacco trade, which whatever else you want to say about it is generally peaceful. And in here, I think by last count, they were approaching or around 90 different tobacco retailers around Victoria and elsewhere in Australia that have been firebombed over the past year and a half. And that doesn't show any sign of stopping at this point. So I think there's really clear lessons here in Australia, which is that prohibitionist policies can spell out of control with tobacco, just like they do with every other substance where they've been tried. And also that there's a lesson here on how to tax cigarettes, because there is a case for taxing cigarettes more highly than a lot of countries currently do. But I think the lesson from Australia is that you have to give smokers an escape hatch. If you make cigarettes extremely expensive and you also make it impossible to legally buy vapor products or other safer alternatives, then your policy is going to fail. People are not going to stop smoking, and you're going to create these massive illicit markets. And there's a close analog with New Zealand, which has almost as high rates of cigarette taxes, but also a much more liberal approach to vaping. And what we've seen there is that you don't have these problems to nearly the same extent with illegal markets. And you also see smoking rates falling much more quickly in New Zealand than you did in Australia. So it's a pretty clear illustration of how these policies can go wrong.
Absolutely. New Zealand is really close to hitting the smoke-free target, actually, due to their policy. However, they're still also introducing some of the restrictions, which is saddening to see. Those were restrictions on disposables and also the pod systems, which is a lot of papers use pod systems. I'm a pod system user.
Yeah.
It's really, really sad to see. So I hope they will reconsider that, because vaping generally has been working for them. And that's really great to see as a case study, in contrast to countries such as Australia. So you've also written not only about countries where the policy seems to be failing, but also where the more liberal policy seems to be working. And we at WVA mostly talk and focus on vaping, obviously, but we also endorse all kinds of less risky nicotine alternatives that tend to work for consumers and tend to decrease the smoking rates. And you wrote this very interesting piece on Japan and the heated tobacco use and how the smoking rates have been declining there. So can you tell us more what kind of policy has been in place there and generally what's going on?
Yeah, Japan is really interesting, and especially because it's one of the last places you would expect to see successful tobacco policy. Japan has historically been very, very smoke friendly. Smoking is ingrained in the culture. They're not nearly as anti-smoker as a lot of places have been. Like whereas in the U.S. and Australia and other places, smoking becomes very stigmatized. In Japan, it was more, they take a more polite approach, like, please don't smoke here, please be considerate. And then on top of that, the Japanese government actually owns about a third of Japan Tobacco. So the government itself is heavily invested in selling cigarettes. So with all of those factors, you would not expect to see Japan to be succeeding on fighting smoking. And yet you've seen really good results in recent years with accelerating declines in smoking rates. And it's partially a policy issue, but the really interesting thing there is that they're actually not allowing vaping, but they do allow heated tobacco, which is, for people who don't know it, it's a really interesting product that is kind of like, I describe it as a hybrid between vaping and smoking. It uses actual tobacco and like actual specially treated cigarettes, but they go into an electronic device that doesn't actually ignite them. So it actually just vaporizes, creates a nicotine vapor from the tobacco in the cigarette. And there's lots of questions about where the relative risk falls in terms of how safe that is. But the general consensus that I think seems pretty reasonable is that it's probably significantly lower risk than smoking cigarettes and maybe a little higher risk than vaping or snus or other ways of consuming nicotine. So not a perfect product, but probably pretty viable as a harm reduction product. And it wasn't really promoted by the government in Japan in any way. They didn't put out a health campaign saying, hey, you should switch from smoking to heated tobacco. They didn't tax it differentially. It just kind of happened naturally. The products were introduced and people started taking them up. And you've seen some pretty striking results, which is David Sweener and other health economists have looked at research on before and after the introduction of heated tobacco. And they found that the smoking rate in Japan was falling by about 3% prior to these products coming on, and now about 11% in the years after. So a really dramatic increase or a dramatic decrease in the smoking rate. And then sales of cigarettes themselves have fallen dramatically. So the figures they got from the industry were 180 billion cigarettes sold every year in 2015, down to about 100 billion now. So almost a 50% fall. And there's mixed reviews on this. Like some people in tobacco control, really don't like heated tobacco for some valid reasons. And, one point they bring up is that not everybody who uses these products is quitting. They might be dual using. So they continue smoking. They see heated tobacco as a way to maybe use tobacco when smoking isn't available, but then they smoke at other times. But I still think there's no way to look at nearly halving the use of cigarettes over such a short time period as anything less than a success. And obviously doubling would be a tragedy. So these are symmetrical situations. So Japan is an object lesson in how just making safer products available and not even really doing anything on a policy front except giving people this choice can actually yield pretty good results.
Yeah, it would be nice if we did the same for vaping as well, though.
Mm-hmm. For sure.
But let's move on to one of the hottest topics probably in the vaping world, and that's flavors and flavor bans. Flavors are an important factor for adults to quit smoking, but usually policymakers just go around and ban them all around the world. And we've been fighting that and trying to raise awareness of how important it is for flavors to actually exist because adults are using those products too. And you wrote this article about the flavor ban and undesired consequences that it had in Massachusetts and this kind of case study. So maybe you could tell our listeners about what happened there, because it was a very interesting article as well. And generally, what would be your opinion then of the flavor bans? So are they effective?
Yeah, so Massachusetts is the first state in the United States to pass a flavor ban for all tobacco products, including nicotine, tobacco, doesn't matter. Flavors across the board. We've had a few other states pass flavor bans of various kinds, usually not quite as extensive. And actually, this is a really good point to highlight. Actually, what's more popular is bans on flavored vaping, while still allowing menthol cigarettes. So they allow the flavors in the much more dangerous product, which is very hard to wrap your head around. But yeah, so Massachusetts was the first to implement a statewide ban, and it had applied to menthol cigarettes and flavored vapes. And pretty predictably, the result has been that there's a lot of illegal products coming into the state. So you saw a pretty clear illustration, like the taxes that they took in Massachusetts fell pretty dramatically, partially due to people using tobacco less, but also pretty clearly because tobacco products were flowing in from surrounding states that didn't have the same restrictions. And I think the more pressing issue, well, there's two there. One, there's been some limited research that when you ban flavors in e-cigarettes, you do actually see a little bit of reduction in youth vaping uptake, but this is offset by an increase in youth smoking. So this is obviously not what you would want to see from a public health perspective, smoking being far more dangerous than vaping. And then from a civil liberties point of view, the advocates of these policies have always said nobody's going to be arrested because of this, that it's only about regulating the supply and applying to retailers and to producers. But we've actually seen that's not true for exactly the reasons that opponents of these measures predicted, which is that while it's not a felony to sell flavored tobacco, in doing so, you are basically automatically violating the tax laws of that state. And that is a felony. And so we've actually seen fairly numerous arrests in the state of Massachusetts and massive seizures of products. In an annual report from their illegal tobacco task force, they actually highlighted as one of the issues that they didn't have enough storage space for all the illegal products that they were seizing. So massive increases there. And the criminal justice system moves really slowly, but there actually are felony prosecutions taking place right now of people arrested in the state of Massachusetts for selling menthol cigarettes or flavored vapes. And so that charge is technically a misdemeanor for selling the products, but the accompanying charges of tax evasion are felonies. And so that act of selling those products is now bringing it to the point where they are facing at least 5 years in prison for all these cases, or penalties of up to 5 years in prison, and then possibly more for the other associated crimes. So yeah, the upshot of this policy is you have probably an increase in smoking, and you have many more people being arrested. You have much more police activity. And if it hasn't happened yet, then in the really near future, we are entering a state where people will be sentenced to prison for selling flavored vapes or cigarettes, which is something that I think a lot of us never thought we would see based on, I mean, it doesn't surprise me, but I think a lot of people in tobacco control, thought this is something that would not happen and that they would never see.
Yeah. Plus, flavor bans always have this effect that vapes get less attractive for adults who are smoking to quit smoking. So that's another negative implication of it. But we've talked about many different case studies, I would say, in this interview and podcast, and that drives me to my last question. We're always asking consumers to be active and to raise awareness about harm reduction generally and how it helped them, and raise their voices against this type of prohibition as it affects them negatively. And what would be your stance? What consumers should do to fight this type of negative policies?
Yeah, so I think some different advice here on what a lot of people say in the field, which is, I think having facts on your side matters and is really important. And we do have facts on our side. There's a tremendous amount of science on the potential for safer nicotine products to reduce the harms of smoking. But when you are talking to politicians, especially at a local level, you're already disadvantaged when you go into these debates. And I've testified in Portland, at our county council meetings about flavor bans. And, where I live is one of the most drug-friendly places in the world in terms of the policies that we've pursued. We've legalized cannabis. We have a huge alcohol industry. We decriminalized all drugs for a while. We've allowed psychedelic therapy. So in many ways, we're a very liberal jurisdiction. And yet the county I live in, banned all forms of flavored tobacco. And there was just it was hard, very, very hard to testify and talk to the council members about these reams of science that you have on your side and to get them to read these very dry studies. When on the other side, you have the activists coming in, with matching t-shirts funded by Michael Bloomberg, talking about how the tobacco industry is addicting our children. And they have a much more lurid tale that you're up against. And that's very hard to persuade people, people who aren't invested in this topic, who are just kind of casually following it, perhaps, to dig into it. And so I think while it's very important to talk about the science, we also need to be focused. We need to frame this in a way that's very focused on individual liberties, because people are receptive to that, even if they don't really know anything about the tobacco topic. And so we see that with alcohol, with cannabis, and I think if you look at it objectively, you should be far more worried about teenagers drinking than you should be about teenagers vaping. And yet nobody is out here where I live saying we need to ban flavored alcohol, flavored seltzers, flavored liqueurs that are very appealing. We just take it for granted that those are things that appeal to adults as well, and that adults should have the freedom to buy those. We see it with cannabis as well. We have stores here selling all kinds of cannabis gummies and vape products and fruity flavors. Nobody's upset about that. Well, some people are, but nobody takes them seriously. Yet when it comes to vaping and nicotine, which is, compared to alcohol, I think is certainly lower risk, those arguments don't land. And so we really need to frame it in a way that centers the consumer, the adult consumer particularly, to say that, hey, this is my body, this is my choice. I want to use these products. Who are you to tell me that I cannot? And I think that's a much more compelling argument for someone who's only casually following the issues to be receptive to.
Thanks so much. It's very, very interesting, and I'm sure our listeners will enjoy generally the interview and also the advice. So thank you so much for your time today. It's been a pleasure.
Yeah, thanks, Liza. Thanks for having me on. It's been fun.
Absolutely, anytime. And to our listeners, thanks for tuning in. And also, of course, wait for another episode next week. Stay with us and vape on. Thank you so much. So thank you for listening, everyone. I hope you enjoyed our episode with Jacob Grier. Make sure to go to the website jacobgrier.com and learn more about his works on tobacco policy and different topics that he's writing about. Want to thank Jacob again for being with us on podcast. And for those of you who don't know much about us or it's the first time listening, please also go to the worldvapersline.com and learn more about our campaigns and the work that we've been doing so far to advocate for harm reduction. Stay with us, vape on, and until the next episode.